Hello everyone, I'm Dr. Maria Cecilia Licuan, the Dean of the College of Rehabilitation Sciences of De La Salle Medical and Health Sciences Institute. During my younger years, I saw how important it is to serve the people through healthcare. And being an only child, I know that in the future, during the time I was choosing program for my tertiary studies, I felt that I can be of service not only to my fellow men but also to my parents by the time they would need it. And it happened. So because of my health profession, I was able to fully serve my parents, and at this time, the academe as well, nurturing more professionals in the future. De La Salle Medical and Health Sciences Institute has another college known as the College of Rehabilitation Sciences, which at this point in time offers 3 allied rehabilitation programs. The first, established in 1979, is the baccalaureate program in physical therapy. And then established in 2011 is the baccalaureate program for occupational therapy. And the third, the youngest of all, established in 2014, is the speech-language pathology. So to differentiate physical therapy from occupational therapy to speech-language pathology, I would use an analogy. The physical therapy profession would focus on mobility, physical aspect of function, how to move and how to walk. But when you walk, you need to be dressed up, you need to have a purpose while you are walking. That is occupational therapy. Occupational therapy puts meaning into the movement because of function and purpose. Are you going to use it because of your work or profession? Are you going to use your mobility in order for you to accomplish some activities of daily living? That is occupational therapy, including recreation and leisure and work. Now, in order for you to communicate, relay your message, and understand what is being told to you, speech-language pathology would be the profession to help those who are challenged with speaking and communication. So that is how important these related rehabilitation science professions are. And we value function and optimization of quality of life, regardless of the condition. So we work hand in hand. That's why it is called rehabilitation sciences. There are a lot of schools offering physical therapy, also occupational therapy, and few schools offering speech-language pathology. Why choose La Salle? What would be the advantage? If you take the program of PT or OT or speech-language pathology here in De La Salle, we promise you a nurturing environment as we take care of you in terms of achieving the learning outcomes needed for each of the program. Another advantage would be here in the College of Rehabilitation Sciences of De La Salle, we have our own base training hospital and also our satellite facilities outside of our affiliation centers, where we make sure that our students engage in the actual clinical practice. The advantage here is we directly monitor and supervise the training process, so that we are guaranteed that the outcomes that we want are achieved for each of our programs. Another thing, especially for physical therapy, we are partners also with other La Salle schools in terms of our sports physical therapy program. So we are connected with De La Salle University Manila Athletic Performance Group, and also with De La Salle Binild, De La Salle Zobel, De La Salle Canlubang, and even the pediatric population in De La Salle Antipolo. And other than that, we have our own neurodevelopmental center here in De La Salle University Medical Center, De La Salle Medical and Health Sciences Institute, which broadens the practice of the rehab profession from pediatrics to adult, even for specialized practice like sports. So that is the advantage compared to other schools. And we promise you a very nurturing faculty, staff, and administration that supports the holistic development of our students. Well, I wanted to add a plus factor to it. Normally, the outcomes that we want for the rehab profession would be anchored on how well we manage clients, particularly in the health profession needing rehabilitation. So, key competencies related to the screening, examination, giving of intervention, prognostication of the case, and even the diagnosis and also the re-evaluation of outcomes. Those are standard clinical competencies that we need in order for us to deliver the healthcare. But what are the additional factors? There are also non-clinical and behavioral aspects that would help our students for holistic development. We wanted to train them to exit this program in a way that they would put value to the life of those who need their care, whether it's PT, OT, or speech. We want to make sure that they are able to communicate well to the families and even to the clients or patients that they would handle. We wanted to make sure that they exit not only clinically competent, but also leaders in their own field of expertise. We also wanted them to be Lasallians, meaning to say they serve the least, the last, and the lost. And all of these competencies put together makes the package of finishing the program of rehab sciences here in CRS of De La Salle more beautiful compared to other schools. Here in the College of Rehabilitation Sciences, we wanted to make sure that the life of every student is balanced. We do have a very challenging and tough academic environment. But how do we balance it out? We make sure that we have extracurricular activities. We wanted to make sure that student wellness and development is in place. So we do have what we call college days, or we call it vital signs, wherein the students, especially the leaders and the entire student body, would have some programs outside of the academic environment so they become leaders of service and also enjoy the social life of their generation. So we have that. Other than that, we expose them also to some international exposures. We have partner schools globally that would help them experience what is it to become a student in other schools having the same program. We have partners in Spain, like La Salle Madrid, and also Barcelona. We also have partners in the United States of America, like St. Mary's University. We also have Lewis University. We have La Salle, Philadelphia. And right now, we are working on other partners in Asia and even in the United Kingdom. So all of these are global opportunities for them, which are empowering their training here in De La Salle. holistically. Other than that, they do have some spiritual activities like recollections and retreats, and they also have an environment wherein they can be trained also for community service. So if you look at it, it's a holistic way of building the framework of what is needed for PT, OT, and even speech-language pathology profession. When someone gets sick, when someone is diagnosed of an illness, when someone has encountered a debilitating condition, life doesn't end. Quality of life should still push through. This is where allied rehab professions come in. Physical therapy would ensure that they are still able to move despite having a stroke. Physical therapy would ensure that the physical aspect of their body would continue to be mobilized. Occupational therapy would make sure that they would still be able to have meaningful use of what they have. And in terms of work, in terms of play for children, and even for recreation and leisure. It gives meaning in their lives when you are functional. When you are not able to communicate because of your condition, speech-language pathologies would have those strategies that would help the patient go back, and at least have that function of being able to communicate to others and understand also what others would give. That gives us quality of life. So if there are professions that would put life to people who are diagnosed of problematic cases and causing them to not perform, rehabilitation experts would come in to ensure function and quality of life. That's how important these professions are in the healthcare industry. For those of you who are beginning the journey in any of the rehab sciences programs, especially here in De La Salle, I want you to be inspired by the philosophy and value of service to humanity through the healthcare professions of PT, OT, or even speech-language pathology. It is so fulfilling if you see people being able to walk again, even if they were debilitated. It's so fulfilling if you are able to see children who cannot talk to be able to speak and convey their message. It is so fulfilling if you see people who lost their job to be able to return to their work because of what you do. So here in this profession, as you enter the program, please know that all of the skills and the knowledge needed will equip you to become better members of the society. And as Lasallians, I encourage you to make sure that your passion for service will be dedicated to those who cannot afford it, to those who are lost, to those who are least and the last in terms of having this quality service. I welcome you all, and I do hope you would enjoy our journey together.